Hi, my name is Dr. Rudra and through the Oral Health channel, today we're going to be talking about who is an oral surgeon and what all procedures do they do. Let's start. So today we're going to be talking about this branch of dentistry which is known as oral and maxillofacial surgery. It is a discipline in the Master of Dental Surgery which requires at least 3 years and any sort of fellowships that are required as per the doctor's directive towards their own aspirations. Now these are the most, I would say, hard-working dental surgeons that are present, because not only do they work around the mouth, they also work as proper surgeons in the operation theatre when it comes to anything above the head and neck, which is basically the facial skeleton and plastics and cleft lip and palate. So let me start off with what their basic work role is like. They are experts in dental extractions, especially wisdom tooth extractions or wisdom tooth impactions. On top of that, they are trauma surgeons. That means anything that is related to the facial skeletal and the oral cavity, any sort of dental fractures that are related to that. They are experts in that. They are trauma surgeons who go and visit the ER and operate on the operating table in an actual operatory, that is the operation room, under general anesthesia. Their knowledge of anesthesia and all the IV medications is fantastic. Secondly, they also work in cleft lip and palate repair. On top of that, they work in facial aesthetics, orthognathic surgery, facial plastic surgery, and many other things apart from what I've already said. They also do biopsies, and their way of life is very different than most of the surgeons who practice in a dental clinic. They might have their own dental clinics, but they are also usually attached to hospitals where they operate in the operation theatre for all the kind of cases that are there. After their 3 years of post-graduation, they tend to go for whatever they aspire to in the form of fellowships. And they also operate, on cancers, head and neck cancers. So basically, they are the most typical surgeons, from the category of dental surgeons. And they know the nitty-gritties of how emergency medicine is handled, how palliative care is handled, how anesthesia is handled, how inpatient, outpatient records and notes and all the jargons that are required for treating a patient in a hospital setting under general anesthesia are done. So these are one of the most qualified and skilled surgeons that you can find in the dental category. Oral surgeons are the most hard-working dental surgeons that you can actually imagine, because of the wide nature of the job profile that they have, and also their experience, their vast experience over the period of time is something to be very impressed by. So that's it for today. Please like, share, subscribe, and do press the bell icon for important updates. If you want to get in touch with me, here are my social media handles and my WhatsApp number. Kindly refrain from calling directly, as I might be busy with patients. Drop me a message with your name, your age, and what oral problem that you might be having, and I'll get back to you within a couple of days. If you have any queries, apprehensions, doubts, suggestions, or insights, kindly feel free to put them in the YouTube comment section. So that's it for today. Thank you.